Hello, I'm Kennedy Waite, and I'm here with Daniel Hicks and Lauren Howard, and we're going to talk about the assessments and interventions for children with dyspraxia in a school setting. The purpose of this critical literature review was to develop research skills by looking at 8 peer-reviewed articles with the goals of finding answers to our research question. It is to be noted that occupational therapists have the knowledge and ability to help children with dyspraxia when presented with accurate assessments and intervention strategies, as we're going to note later. Our guiding clinical question: what assessments provide an accurate measurement of the impact dyspraxia has on a student's learning, and what interventions influence developmental outcomes in a school-based setting? Some background on this topic. Another name for dyspraxia is developmental coordination disorder, or DCD, which is what we're going to refer to throughout this poster. DCD affects 6% of children that are school aged and makes them appear uncoordinated and clumsy compared to their typically developing peers. Occupational therapy has the ability to help children with DCD in a school setting by using a holistic approach.
For the methods, the databases that we used were CINAHL, EBSCO, and PsycInfo. And for the search terms, we used a truncation approach. And truncation is also known as wildcard searching. It lets you search for a term and variant spellings of that term. To truncate a search term, do a keyword search in a database, but remove the ending of the word and add an asterisk to the end of the word. So our search terms included academic, child, DCD, dysprax, educate, intervene, learn, pedia, and treat. The inclusion criteria included it had to be published between 2016 and 2022, focusing on children. The exclusion criteria included studies 10 years or older, not in English, and solely focused on the adult population.
Okay, so now we're going to talk about the results. As we discussed earlier, we have a dual-headed clinical question. So we gathered universal data on assessments and interventions. Starting with assessments, we found that the motor assessment battery for children 2, or the MABC2, is the most common assessment used for children with DCD. However, the Canadian Occupational Performance Measure, or COPM, produced the most effective assessment results and should be used with children with DCD when available. Switching to the intervention aspect, we found that the co-op, or the cognitive orientation to daily occupational performance, is the most commonly used intervention for children either diagnosed with or at risk of developing DCD. Other successful interventions included virtual reality and play-based therapy, which both wielded positive results, but more research should be done on these topics before they're implemented. As for clinical implications, DCD affects a child's ability to engage in occupations. Using assessments and interventions specific to children with DCD, an OT can assist in forming ideas, planning, and executing those ideas as interventions. Having the gold standard for assessments for DCD will aid in defining strengths and weaknesses and help-based interventions.
So for limitations of our critical literature review, there were participants receiving different therapeutic assistance in terms of length and occurrence of therapy sessions. Also, many of the articles selected participants from small regions without much diversity. Another limitation included limited access to numerous articles unless they were purchased. For some future research, future investigations should examine specific ways in which therapists can assist children with DCD in the school setting, as well as using a longitudinal study.
Thank you for listening to our poster presentation about the different assessments and interventions that can be used for children with dyspraxia, specifically in the school setting. On the next slide, we have a QR code that you can scan for access to our abstract and our references that we use throughout the presentation.